Okay, go.
Okay. Sorry, Valerie, it has taken us so long to get you this video. I was just being flaky, I guess, and I kept forgetting. But here are the exercises that the occupational therapist has given us to do with Lane. I'm only going to do one of them each, and then I'll just tell you how many times she wants us to do it for. So the first one that she wants us to do is this one. We call it the invisible mustache. And I'll actually just do all of those ones because they're pretty quick. You do that one 5 times. And you kind of just put gentle pressure while your baby backs away and tries to avoid getting his exercises done. So you do that 5 times. And then this one is kind of hard and you have to cut your nails short. But you stick your finger in and you start where their little upper lip is and you make a C shape while you pinch. And you do that 5 times on each side. So I'll do it one more time. You start up there. And then you kind of gently pinch while you rotate both inside and outside. He usually really doesn't like that one, but we caught him at a good time. So,
and then do the same for the other side.
Yeah, and you do it for the other side as well.
With the other hand.
Well, if you can do it with the same hand, you can do it with the same hand. I'm not the boss of you. I do it with 2 different hands as well. But this actually, if you have a bumbo, it's really good to set him in the bumbo to do these exercises. The next one that we do is you put your finger inside his mouth. And if you're finger feeding, then you're probably already kind of familiar with this, although you may do it this way instead. You put your finger in his mouth and you put it mid-tongue. You want to, our occupational therapist calls it mid-blade. And you kind of just gently press down. And you can tell he doesn't really like the feel of it. I'm just sort of gently pressing down. If Margot pulls her tongue back when you do this, follow her tongue. You might make her gag, but the occupational therapist said that that's okay. What? Are you saying hi to Margot? Hi, Margot. Hello. And then you will actually do the same thing for the next exercise. Sorry, the tongue depression you will do 5 times. Although if you're finger feeding, you can do it as often as you want while you're finger feeding, just to give her the practice. The next one you will take
Bless
you. Bless you. Are you done? Can we move forward? Okay. The next one you will take a pacifier or a bottle nipple. Oh, hi Margot. Stop trying to impress Margot. He's just all about it. Okay. So you will take your pinky and you'll put it inside of a binky. And then you will do the same exercise you just did, except you'll do it with a binky. And he will she will almost certainly start sucking on it. He always does. But it's just one more way to kind of get that exercise in. I think it pisses them off a little bit less, and that's why she does it. She has us do it that way. Okay, the next one, Julie baby. The next one, you're going to take your finger, and you're going to touch the back of their gum line, right where their molars will be when they finally get them. She's not going to like this. He really doesn't like it. She'll probably chomp on your finger. And you just kind of gently, 1, 2, 3, 4, 5. Just pull on it a little bit. Not a lot. 1, 2, 3, 4, 5. And you just do it like that once. You do 5 little push downs, but you only do it once. And then this is the last one that she taught me how to do. She taught me how to do this one last week. She said just take a little baby washcloth and just... She wants us to stretch this out for him, help him stretch this out, and still a little here and a little here as well. So all you'll do is you'll take the washcloth, and you'll go 1, 2, 3, and 1, 2, 3, and then the baby will try and eat it, and then you'll go 1 on top, and 1 on bottom. And the occupational therapist also, at his last appointment, noticed that he's shoving his hand in his mouth a lot. She says that that is actually great, so hopefully Margot has started doing that. She says that if it has to do with the area in his mouth, that it'll help stretch it out. So we hope you had a good Thanksgiving weekend. And again, I'm sorry it took me so long to get this video. And we will see you in a couple of weeks. Happy Thanksgiving.
Bye. Say bye, Lane.
Bye.